How does kidney MRI tell benign from malignant masses? Imagine trying to tell apart a harmless bump from a dangerous tumor inside the kidney without opening the body. That's where magnetic resonance imaging, or MRI, comes into play. It's a powerful tool that helps doctors see detailed images of kidney masses and figure out if they are benign or malignant. But how exactly does it do that? Let's explore. First, MRI uses strong magnets and radio waves to create detailed pictures of the kidney tissue. One key technique is T-to-weighted imaging, which shows differences in water content within the tissue. Malignant tumors like clear cell renal cell carcinoma often appear with mixed or higher signals on T to images, making them look more heterogeneous. In contrast, benign lesions such as tumors or fat-poor tumors tend to have more uniform or distinct signal patterns. Sometimes, benign tumors contain fat, which MRI can detect easily, pointing toward a non-cancerous diagnosis. Another important method is diffusion-weighted imaging, which measures how water molecules move within tissue. Cancerous tumors usually have high cellularity, restricting water movement, and resulting in low apparent diffusion coefficient values. Benign lesions like tumors or papillary renal cell carcinomas often show less restriction, with higher ADC values. By analyzing these diffusion patterns, radiologists can gather clues about whether a mass is likely benign or malignant. Dynamic contrast enhanced MRI adds another layer of information. After injecting a contrast agent, the way the lesion takes up and releases the contrast helps differentiate types of tumors. Malignant tumors like clear cell renal cell carcinoma tend to enhance rapidly and intensely during the early phases, then wash out quickly. On the other hand, some benign tumors, such as tumors, may show delayed and less intense enhancement. Certain subtypes like papillary renal cell carcinomas tend to enhance gradually without the quick washout pattern. These enhancement behaviors are like fingerprints that help identify the nature of the mass. Looking at the shape and internal features of the lesion also provides clues. For example, if MRI shows macroscopic fat within the mass, it's likely a benign tumor. Features like central scars can be seen in tumors but are not exclusive to benign tumors, so they're not definitive on their own. The borders and growth patterns are also considered, but sometimes benign and malignant tumors look very similar, making it tricky to tell them apart just from images. Despite these advanced techniques, MRI isn't always able to give a clear answer, especially for small tumors under 4 centimeters. In such cases, doctors might recommend a biopsy or even surgery to get a definitive diagnosis. So, while MRI provides a lot of helpful clues by analyzing tissue signals, enhancement patterns, and structure, it's often part of a bigger picture that includes clinical evaluation and sometimes tissue sampling. In summary, kidney MRI uses a combination of imaging features, like water content, how the tissue restricts water movement, and how the lesion reacts to contrast, to help distinguish benign from malignant masses. This multi-parametric approach improves accuracy but isn't foolproof. That's why consulting with healthcare professionals remains essential for proper diagnosis and treatment planning. Always remember, each case is unique, and medical decisions should be personalized based on a full clinical picture.